So for today, I have two tasks. The first task is to speak about the World Federation, and I will try to do that. And I've simplified my talk into maybe 14 topics. And then secondly, that has been announced by Stanislav before, I will give some idea what I think is important to know about neurologic problems in neuro-oncologic patients. So by that I start. Next slide. So we have a motto, a mission, which is called Fostering Quality Neurology and Brain Health Worldwide. Sounds simple, but I think it clearly means what it says, to take care of neurology and to foster the quality. And the second part, worldwide. And this is the first mission of the World Federation, to be active worldwide. The bottom one below is that without neurologists, without training, without CME, and without CPD, no progress can be made. And neurological education and training is very strong on our list. Next. So this is what I'm going to speak about, and I will start to explain what the construct of the World Federation is. I will introduce you the regions and the trustees. I will then briefly speak about committees and what I'm changing. I will speak about education, some projects, about our publications, and about the educational day. We have a World Brain Day that's going to be on the 22nd of July. Then I have already started speaking about the WHO and about ICAP, and I will add to this. There is a United Nations agency that's called ECOSOC, Economic and Social Council, which is a very high-level administrative council, and the World Federation is being privileged since 2 weeks to be also a member of that council. I speak a little bit about regions, diversity and young neurologists, and something that we all have to think of as neurologic societies, to have patient platforms for various purposes. Next. So what is the World Federation physically? Physically, the World Federation is a non-profit organization. It's a UK charity. The UK charity has quite a stringent, strict, and thorough governance to which we have to adhere. It is, we have at present 123 member societies. And you can see, if you look at Google, you will find that maybe 190 states exist. This changes, as we know. And so we have 2/3 of possible members. We don't have national societies, we have member societies. And this is very important because national societies can be difficult in some controversies of nations. We have a Council of Delegates, and Moldavia has a voice in that Council of Delegates, and I've always tried to keep it the way that we have one voice per country. We have trustees. These are the elected officers. I'm a trustee. And there are committees that we have recreated. And also very close to the heart of the organization are the specialty groups. Next. So this is the distribution of the members. And you can see, of course, North America only has 2 members. This is the American Academy and the Canadian Society. In Middle and South America, we have 20 members. You can see here, Europe is very strong. Asia is strong. Despite our efforts in Africa, we don't have extremely many members, which there are many reasons for that. But the World Federation considers this bulk as our regions. So we have the North American region, the Latin America region, the European region where the EAN is our partner, the Pan-American region, Pan-African region where AFAN is the society, the Pan-Arab region, and the Asian Oceanian region where we also are trying to improve our contacts in the future, but they are well organized. Next. So the trustees, the composition of the board of trustees is there are 4 officers, a president, a vice president, a treasurer, and a secretary general. Then there are 3 more trustees, sorry, and 2 elected trustees, co-opted trustees. For this time, when I started the work in the beginning of January, I had the possibility to exchange a few people and also co-op trustees. And I was in the fortunate position that all regions of the world are presently represented in the board of trustees, which hasn't had before. But of course, depending on the new elections that will be in 2022 in Amsterdam on the 25th of October, this may change again and we have to reshuffle. But the idea is that the regions are more represented in the World Federation than they were, because regions and needs are what we have to take care of. Next. Indeed, the World Federation, and this was started by Professor Carroll, my predecessor, on the needs registry that is trying to attempt to define what needs are in the regions. And this would be a number of neurologists, access to medication, access to care, apparative machines like computers, tomographs or MRs, EEGs, etc. And this neurological needs registry is being worked on and will be a useful tool. Next. Now these are the trustees, and if I go from left to right, so this is myself. Next to me is the Vice President Grisold, who is from Montreal, and will also be the president, the Congress president of the next World Congress. Professor Stark is the treasurer, who has been doing a very solid work in taking care of the finances of the World Federation. Professor Marco Medina has a very long history in the World Federation, and particularly with education and also with the foundation of the Latin American neurology. Ala Gücht, who is known to you, is from Moscow. She has had a long experience with epilepsy. Not only that, she is also very experienced in the WHO matters, advises us in this respect. Professor Friedman, who was a trustee, then was not re-elected, but was now re-elected, is taking care of communication and e-learning, and I will come to that in a minute. You may know Stephen Lewis. I think he's one of the most popular of the trustees. He's the editor of Continuum, and he also is the editor of World Neurology. In regard to publications, to speed, to editing, I think there is no one who is better than him, and we appreciate his help and work. As the co-opted trustee, I was able to choose Professor Riyad Gouda, and Professor Riyad Gouda in that board represents Africa and the Arabian countries. Of course, the Arabian countries would prefer a representative of just of Arabian countries, and the Africans would also prefer a representative just of Africa, not only of Africa, but maybe one for South Africa, one for Sub-Saharan Africa, one for North Africa, but this is not possible. And Professor Riyad is very excitingly taking care of the needs. And we have Professor Mestram, whom you may know from our eminent neurologist presentation and also from the neuroinfectious diseases. He's also a co-opted trustee. He's from India, and he's helping us in the moment a lot with a COVID website where he's updating the reports monthly. So this would be the present situation, and at stake for the next election is my position as the Secretary General, because I'm now the president, and the other position that's going to be elected is Professor Stephen Lewis, who is at the end of his second period as a trustee. So today, by the way, the nomination committee of the World Federation has issued the names of the applicants. And there are, I think, 3 for secretary and 4 for trustee. Nevertheless, if one of you wants to apply for that, until it says in the internet, I think until 6 weeks before the election, with the support of several countries, you can always nominate yourself. This nomination committee is, let's say, a sacred cow in the World Federation. And not even I, as the president, know their proceedings. I just know who is appointed, and they give recommendations that we think is important. Next slide. So we have looked at the committees, and my opinion was that we have too many committees for too many things. So we have, on one hand, reduced the number of committees. On the other hand, we have given some subcommittees to some committees. So I start with the easiest thing. Public awareness, as you know, is a committee that takes care of public awareness, but it also takes care of the World Brain Day. So what the public awareness will get as an additional point is the establishment of a patient forum, because the World Federation has many things but no patients, and the time has come where we have to look at that. The membership committee will be chaired by Professor De Visser, and she will also have a subcommittee on diversity and gender. And the education committee will have several subcommittees, and I will explain this to you on the next slide. So what we have been doing is that we tried to diversify our many educational projects and objects. So the e-learning committee is something that is chaired by Professor Friedman, and its idea is how to implement e-learning more into the World Federation. As you may see, we have started an e-learning hub that is improving, but has still much potential. Dr. Struhal from Austria is chairing the e-communication committee, who gives us advice on electronic communication, quality issues, and how things are done in the world of the internet. Not to be introduced is Continuum, and I hope Moldavia has Continuum, which is an American academy production that is produced, I think, 4 times a year, and is directed towards education and CME. So if this is not available in Moldavia, then Dr. Lisnic needs to write a request. We have a standards and evaluation committee. This is chaired by Dr. Vecchai, and this committee looks at complications from congresses, meetings, which can be difficult because sometimes from an even so well-written application, it's not clear whether this meeting is industrial interest or really scientific interest. One of our babies of my babies are the teaching centers. That means that we have several teaching centers worldwide, and I'll come to that, and we will make a subcommittee consisting of the chairs of the teaching centers. And the new product comes up, which are the so-called educational days, and I'm sure you saw, maybe some of you have seen our educational day on epilepsy, stroke, and already 2 educational days on headache, jointly with the American IHS and GPAC. Next, please. So this is the logo from the last headache day. This was, I think, 2 weeks ago on Saturday. And I'm proud to say that we had 800 people listening. And the talks were done half by an international faculty and half done by a faculty of African speakers. So what else do we have? We have the teaching courses at the World Congress. We have Congress stipends. We have the Junior Fellow travel fellowships, and we also have, for educational purposes, also the Mansett Prize. Next. So I have spoken briefly about teaching centers. This is something that we decided to empower regional, local universities to teach. And we have now 4 in Africa, which is Rabat, Senegal, Dakar, Cape Town, and Cairo. And in the Americas, we have Mexico. What do we offer there? We offer in 3 centers a 4-year trainings with complete neurologic training. And in the others, we have fellowships, general fellowship, neuromuscular, and epilepsy. We also have department visits, and I think this is my copy that I introduced, that we copied from the EFNS. And if I remember correctly, one of your professors was visiting my department in Vienna once upon a time. And out of that, our strong relation comes. And we have department visits in Turkey, Austria, Norway, Italy, and Germany, and also Canada. And now we also have introduced or experimented with short webinars on special topics. And one of our specialty group, this is Neurology, has made a webinar on cancer growth and neural mechanisms that was attended by about 400 attendees, which is a lot for a rather complex topic. Next slide. So these are pictures that we like to show, but on the left side you see Rabat. Rabat has a very, very new modernized school, and I want to just to emphasize that our task to have teaching in the regions is not that to be a missionary and do all wonderful things. Our task is, and we are committed to that, to empower regions to teach themselves. The more teaching regions we have, the better. And there are some wishes that in the last years, additional universities have come out of Africa, and we would be gladly to help there and work there too. So if you look at the picture on the right side, you see a historic picture. This was 2013, the first visit of the training center in Rabat, and you can see here Professor El Alaoui, who made this possible technically, and this is Professor Barchakir, who as the president at the time helped to introduce that, and I'm behind the camera, take the picture. Next slide. So I have already said that, but it's always nice to read. So we have in Rabat 1 neuromuscular fellowship and a 4-year training in neurology. I must just add that the neuromuscular fellowships are also financed, half of them, by the International Congress of Neuromuscular Disease, which is a part of the World Federation, and the money we receive from them we dedicate to the education and teaching in Africa. In Cairo, we have general fellowship. In Dakar, we have 1 4-year training and 1 epilepsy fellowship. And the recent decision was that in Cape Town, we have a 4-year training and also a 1-year stroke fellowship, which we will be creating on demand of the Africans and AFAN, as they think this is a really needed thing there. Next, please. So I spoke briefly about the department visits, and this is what is really a great pleasure to see is that We have the department visits now since 2013, 14, and increasingly names who just spent 1 month outside of Africa visiting Turkey or visiting some other countries publish, cooperate, and have received some stimulations. Next. So what publications do we have? We have the Journal of Neurological Sciences, which is a normal, conventional journal. It has an impact factor about 3 something. It's edited by John England. It's running smoothly. And if you have something scientifically, also sometimes cases, the JNS is good to look at. One new development in the past years was the e-neurologic sciences that was headed by Bruce O.V. Begle, who had a very difficult time to host that, and was taken over 2 years ago by Dr. Walter Struhel from Austria, who is really increasing the impact of the journal. It's in PubMed now and has nice articles. It's the only problem is that it's a completely open access program, meaning that it costs to publish. I think it costs for an article 3,000 or 4,000 euros. But I hear from Elsevier that this is not covering the project in regard to all the management needed. We have World Neurology, that's on our website, that costs nothing, and I do encourage you to look at it. I also encourage Professor Liesnitsch for today's meeting, perhaps to write a short report with some images on that meeting, if there is time. We like to report and see what is happening in the world. I have spoken about Continuum. We have books, and you're all aware of the Atlas in Neurology that may need a relaunch with the WHO, and I hope we can do that. And we have also produced our specialty group on migrants, has also produced a book which is called Migrants in Neurology in Migrants and Refugees. And you will not believe it, because I still do not believe it. It has been downloaded almost 5,000 times since it's appeared. So it's a bestseller. I don't know why, but it's a book that looks at the problems of migrants. So next slide, please. So these are the covers. World Neurology is free. You can download it from our website anytime. Journal of Neurologic Sciences and e-Neurological Science. Next. Just to go back, social media, the education day. So the idea was that following this awful situation with COVID, there were less meetings, less live meetings. This is one thing. The other thing, in the low middle countries, in under-resourced areas, travel is not easy. And you may know that in Africa, even going from one country to the next country is sometimes not easy, because there are no air connections and people have to fly to Europe and then back. So it's very costly and not acceptable. So we strongly rely on the concept of the educational days. And as I said, we have tried to do this as on low cost as possible. So we have found a PCO who does the technical management. And we are using an African PCO, which is much cheaper than a European or an American one. And we have faculty who produces these meetings. Essential for Africa for the development of those projects are Mrs. Augustina Jarowe-Felif, who is the current president of AFAN, and our trustee Riyad Gauda, who is the master of announcements and of heading these conferences. If you can see here, nobody can live without social media, and we are trying to increase our impact in social media and using, of course, the usual things, Twitter, Facebook, to promote our activities. And this works quite well. And if you are on social media, look out for World Federation. Next slide. About Continuum, and the Continuum is a really valuable source. It's, as I said, it's edited by Professor Stephen Lewis, and it brings the latest CME activities in regard to selected topics, and is counted as CME in the United States, so it's of high quality. And if this is given to a state or the country, it is expected that the country produces seminars and discussions of the content. Next slide. This is what I mentioned before, the idea about the e-learning hub. The idea was from Professor Friedman, and this is very laudable, that there are so many activities that would be available in regard to neurology, that we should invite those activities to participate in this e-learning hub, meaning that we get programs from other societies and they will be easily found on our website. Next slide. This came out of the discussion I had last week in Marrakesh with the Moroccan Society. They had a large EMG meeting and they produced a wonderful book about EMG, mostly by French authors. Here the text cover is Arabian, but it's readable in French. And the idea was, could we not publish that on our website? And from that came the idea, could we not make a bookshelf for virtual books? Apart from the technical difficulties that may come with copyrights and all these kind of things, it's a good idea. And I will follow this with the chair of the education committee. Next slide. Now, Brain Day. We have a tradition of Brain Days, and we have started with World Brain Day in 2014, after it was announced at the World Federations Congress in Vienna in 2013. We have made several topics over the years: stroke, epilepsy, Parkinson, MS, headache. And this day we used the motto Brain Health for All, that should address the regions, and is quite closely linked with something that I'm going to speak about soon, about the eye gap, about this new concept of integrating neurology step by step into health systems. Next. We have, and this is something we did last year, and it's still on the internet if you want to look at it, with a professional company, we have hosted a so-called Brain Health Initiative last year, and we tried to explain in a series of 5 webinars why it is so important for neurologists to adhere to the concept of brain health. Next. So, what are the key messages for this year's Brain Day, World Brain Day? Awareness, prevention, advocacy, education, and access. So, in short, one should be aware of neurologic diseases, prevent them, advocate for the care of neurologic diseases, educate not only doctors but people, and then provide access into neurological care. Next. One more. Next. So this World Brain Day is happening in the moment, and I think it's very important that we align the topic of brain health with the WHO, who has this topic of brain health and has also founded a brain health unit in order to bring closer the concept of brain health. So this brings us already to the WHO, and the WHO is, as you know, based in all regions, and the center of the WHO is in Geneva, and at present still going on until tomorrow noon there will be the World Health Assembly, where also the IGAP will be hopefully accepted. We have a long cooperation, and it goes back strongly to Professor Ali, one of our presidents. Professor Shakir developed the ICD-11, and now it's the IGAP that has been started with Professor Carroll and some other societies, and is moving along quite nicely. Just to remind, there's also an atlas on country resources. This is the second edition, and we are looking at producing perhaps another edition. Next slide. So now what is IGAP? IGAP, I already said it's important, and it is called IGAP for epilepsy and other neurologic disorders. So it's a global action plan that is trying to implement neurology on several aspects. I just change here the slide that I can read to you what the keywords are. Raise policy prioritization and strengthen governance. Provide effective diagnosis, treatment, and care. Implement strategies for promotion and prevention. Foster research and innovation. And strengthen the public health approach towards epilepsy and other neurologic disorders. You may wonder why it's called epilepsy and other neurologic disorders and not neurologic disorders and epilepsy. But this is the historic development, as epilepsy was the first of the organizations of neurology to put the foot in the gap and really try to advance this topic. The WHO is also involved in COVID groups. There are post-COVID groups, acute, subacute, where we are participating. And for the ICD-11, we've been in the advisory group. And we are producing, as I said, we're producing this registry, which will be also very important, not only for WHO, but also for neurology to be acknowledged where the needs are. Next, please. So I spoke about that already. Next. So on tomorrow, hopefully, after the IGAP will be approved today, I always say hopefully, because this will be at 4 o'clock, I suppose. There will be the intersectoral global action plan on epilepsy. And we have planned to make a webinar jointly with the IAEE, with the child epilepsy, and with IBE to celebrate that. And that's going to be tomorrow at 2 o'clock. And if you want to look at that, please join us. It's on our social media and website, and it will be an important event to celebrate. Next slide. So finally, I come to ECOSOC, which is the Economic and Social Council of the United Nations. I think as physicians, you're all aware that there are so-called SDGs, 17, that have been issued by the United Nations. And this council, ECOSOC, is an advisor to the United Nations in regard to health issues. The World Federation has applied to become a member of that council, and we are now as a non-state actor for 2 weeks, and we have not been at the meeting yet, but it gives us the ears and the possibility to also listen and maybe contribute to high-level meetings of the United Nations. Next slide. Which of course is important that I just had this slide again before, but it is important, and we hope to encourage that also the regions, let's say in your case this would be Europe, participate in the regional WHO activities, as they also sometimes have interesting projects or interesting possibilities to push forward neurology. Next slide. What we are aiming at and what we are not completely advanced is, of course, to raise the issue of diversity and gender. And last year, when we counted the female persons in all our communities, we had about 10% or 15%. And for this year's new composition of committees and subcommittees will go up to 50%. And we will also have formed a group of young neurologists, which will be chaired by Dr. Lehmann from Germany. And we will gladly wait for instructions, and we will also reserve some space in the World Congress of Neurology for the topic of young neurologists. Next slide. What I want to do is, and I've written this in all parts, but it's not so easy. We also need a neurological patients platform where we receive direct input from patients. What I can see is that the EN has successfully worked with EFNA on this topic. We also see that there's a different organization arising that's called One Neurology, which is also trying to be very global, has the aim also of encouraging patients and bringing in patient issues. But we are not, let's say, we are on speaking terms, but we do not want to have a, let's say, a situation of conflict with this organization. But definitely these neurological patient issues are at our heart and need to be implemented into the world of Federation of Neurology. Next slide, please. So we also have congresses. The next one where we are participating, and this has been mentioned, is the Neuromuscular Disease Congress, July 5 to 9 in Brussels. It has an excellent program, many speakers, and may be interesting for you. And of course, next slide. We are looking to Montreal. It's going to be from October 15 to 19, 2023. Just to inform you that the creation of the program is in full progress, and we are looking forward to this exciting event. With that, I have given you a few points of the World Federation, which I think are important and may be interesting for you to listen to, and I'm happy to receive questions. Thank you.